Good afternoon, my YouTube viewers. It is Palestine here, and I'm here to give you an update on my cancer diagnosis. And basically, what happened was last week when I rang the cancer nurse, she said to ring back Tuesday afternoon to get the results of the her2 test, but I couldn't wait. So I rang up this morning before I went into work to get the results of the test and to also tell them that I had this appointment in radiology on Friday, but I haven't received a letter. So there were two reasons why I rang them up. So I had already decided that I was going to keep my phone handy with me, so if they did ring me up, I would be able to answer the phone. And obviously, I haven't told my work yet what's going on because I'm afraid of what's going to happen when I tell them. So the nurse rang me back around 10:30, something like that. And she said that my radiology appointment on the 25th of this month, I don't need a letter. I just go directly into the appointment, and what they're going to do is they're going to put a marker in the tumor. With regard to the her2 test, they still haven't given me the results. She said I'll hear from them in the next 2 or 3 days. So today's Tuesday. So Wednesday, Thursday, Friday. So I should hear from them Friday at the latest. If I don't hear from them after I've had my radiology appointment, I'm going to phone them and ask them myself. And basically, they said, so they still haven't told me whether my her2 status is positive or borderline. And they did let it slip last week that it's not negative. So if they let it slip last week that it's not negative, then that tells me that I'm probably going to have chemotherapy of some kind. She said that they discussed me in their meeting this morning. So obviously they had a meeting and I was the topic of conversation. And she said they're going to have referrals next week as well. So I imagine when they contact me and tell me the results of the test, which I think it's going to be borderline or positive because they let it slip that it's not negative. They're probably going to tell me what other hospital appointments I'm going to need to go to. And the reason for that is because when I spoke to the surgeon, he said that if the her2 test comes back positive, then I will have to have chemotherapy before I have the operation. And I was looking on YouTube, and they've also got something called her borderline, which if it's 1+ or 2+, it's borderline. And if it's 3+, it's positive. But even when it's her2 borderline, you still have to have treatment. So that's it. You know, I'm still not able to tell my work what's going on, and I don't want to tell them until I have to. And the reason for that is because I'm on a 0-hour contract and I have to work through the chemotherapy because they'll replace me if I'm not able to go into work and do the job. They'll find somebody who can. So I will be working through the chemotherapy, and I'll have to work through that, make arrangements to be able to work through my hours. So that's it really. So my next video is going to be on Friday, because I'm going to be discussing my appointment at radiology. And then I'm also going to make another video to discuss the results of the her2 test. So I'm going to be making 2 videos by Friday. You know, I'm going to hear about my her2 results on Thursday or Friday. Hopefully, I will hear about them on Thursday. And then if I hear about them on Thursday, then I'll be able to make a video about it. So it seems like things aren't very good. You know, I'm trying not to be negative, but I'm being realistic about it. I just see this because I've got a grade 3 cancer, which is aggressive. I've got a HER borderline or HER positive, which is aggressive. I've got a type of cancer that responds to estrogen, so I'm going to have to take estrogen blockers. So, although they haven't really told me much, the few little things that they did tell me are bad enough. And so I'm trying not to be negative, but I am a realist that I see this chemotherapy and this surgery and this radiotherapy as just an extension of my life. I don't see it as a cure. I just see it as extending my life, because I've heard lots of instances of people who were younger than me, who had treatment for breast cancer, and the breast cancer came back. Of course, a couple of these people, the breast cancer came back because they got pregnant, and there's not any chance of that happening to me. But I'm sure some of the people that I've studied, the breast cancer came back anyway. I was talking about Beck from Eamon and Beck, that she had breast cancer and she had chemotherapy, surgery, and radiotherapy. And she said that they just told her to go live her life. And I'm not sure that's totally true. I think that they probably advised her not to get pregnant, because she had to do IVF before she had the chemo to get some eggs so they could be fertilized. So if she had to do IVF before she had the chemo to get some eggs before they were fertilized, I'm sure that she knew that she was not supposed to be getting pregnant, because the pregnancy hormones were going to cause the cancer to come back. So I don't think that she was being totally honest when she said they told her she was cured and go live her life. And I do think that there's a possibility that the cancer would have come back even if she wasn't pregnant. But all those pregnancy hormones caused the cancer to come back. And so now she has stage 4 cancer. And there was another lady on YouTube as well, who she got breast cancer really young. And so she met someone and decided to have a baby, and the cancer came back when she decided to have the baby. And it was because of the pregnancy hormones, because breast cancer is aggravated by estrogen. And then they had another lady called Karen Keating, who was Gloria Hunniford's daughter. Now, she died of breast cancer. She got breast cancer in the 1990s, I believe it was. And so she got treatment the first time around that she got breast cancer. And then she got I believe that she got breast cancer in the other breast. That's what I believe. But the breast cancer definitely came back. And when the breast cancer came back, she said that she wasn't going to get treatment. And so she went and tried all these holistic therapies, which they may have improved her quality of life, but in the end, they didn't work. And so she died in the 2000s, maybe 2005 or something like that. So I've been looking on the internet, and there's lots of instances where people who have had breast cancer and who have been treated for breast cancer, and the cancer came back. And so 2 of the instances were when the ladies got pregnant, but one of the instances was she didn't get pregnant. It just came back on its own. And so I'm not under any illusions about the fact that I have an aggressive cancer. It's grade 3. It's most probably either HER borderline or HER positive. So that's aggressive as well. And the cancer is also aggravated by estrogen. So I don't think that my outlook looks that good. And so I'm trying my hardest to lose weight. I know I don't look it, but I'm trying very hard to lose weight. So I guess that concludes it for this video. I've talked about everything that I wanted to talk about. So if you like my video, please like and subscribe. And I will be communicating with you in the next video. Either I will be talking about my her2 status, or I'll be talking about the radiology appointment. So thank you again for watching my video. It means a lot to me. Bye.